Hi, everyone. Welcome. Good afternoon. We are waiting for a couple more people to trickle in, so we will get started momentarily. If you are already joining us, feel free to go ahead and put your name and your email in the chat. This will especially help those who are requesting CE for today. And thank you for those who already got started on that. Remember to include your email if you're needing CE for this as well. We will give it another minute or so since I know that there's a couple people that are still in the process of joining. We'll get started momentarily. Okay, we will go ahead and get started. Good afternoon, everyone. Good morning to some of you. My name is Claire Schuch. I am the Associate Director of Research for the Center for Pet Family Wellbeing. I'm very excited that you all are joining for today's special webinar. This will be recorded or is being recorded, and you will be sent a link of the recording in case you want to revisit this conversation later. Remember, if you just joined us, put your name and email in the chat, especially for those who will be requesting CE for this meeting today. You'll get the link sent where you can complete your test. So, as you may be familiar, this month is Mental Health Awareness Month. And so I'm very excited to present this webinar and our speaker for today. The webinar, Honoring the Bond, Understanding Grief After Pet Loss, explores the deep human-animal bond and the profound grief that can follow the loss of a pet. Led by our wonderful guest speaker, Sarina Manifold, this session highlights common grief responses, different types of grief associated with pet loss, and the factors that can shape this experience. It also emphasizes the importance of cross-disciplinary support, bringing together veterinary, medical, mental health, and social service professionals to better care for individuals navigating pet loss. Sarina Manifold is a licensed clinical social worker, therapist, and educator with extensive experience in grief, bereavement, and veterinary social work. She is the owner of Authentic Healing Counseling and has worked for many years at the intersection of mental health and the human-animal bond. Sarina previously served in the University of Tennessee College of Veterinary Medicine's veterinary social work program, where she provided grief support to individuals and families, taught students, and collaborated across disciplines to support both clients and veterinary professionals. A certified grief recovery specialist and frequent presenter on pet loss, compassion fatigue, and resilience, she brings deep experience and compassion to conversations about honoring the bond between people and animals. So I'm going to kick it over to her. If you have questions, feel free to put it in the chat, and I will monitor that and make sure that your questions are answered either throughout the presentation or at the end. Thank you.
Thank you, Claire. Good afternoon. Good morning to those of you who are joining us maybe from the West Coast. I'm in North Carolina. So it's afternoon for me. So I am honored to have been asked to present today. Grief is my jam, is what I like to say. It's not something, it's a topic that a lot of people feel a little bit more uncomfortable talking about, and it is something that I feel pretty passionate about. So I am going to pull up my slides. Bear with me. All right. And I'm going to hide myself so that I don't have to look at myself through this. All right. So here are a few of our objectives today. We're going to talk about the human-animal bond. We're going to identify some common grief responses following the loss of a pet or an animal. We're going to define and differentiate types of grief associated with pet loss. And then we're going to briefly discuss some opportunities for collaboration among veterinary, medical, mental health, and social service professionals to provide support to individuals after the loss of a pet. This is not a deep dive. We have an hour together, and grief is a huge topic. Pet loss in and of itself, under grief, is a big topic, and I could probably spend all day on several of these components of the talk. So this is going to be an overview, a very generalized overview of some of these topics. So additional deep dives might be important or necessary for some of these, and I just wanted to like put that out there that we're not going there. If you are interested in learning a little bit more, depending on your role, I'm going to put a plug in for the Center for Veterinary Social Work. If you're interested in learning a little bit more as either a social worker, a mental health professional, or an animal care professional, there are certificates that we offer for additional training. I'm also going to invite you to practice some self-care today. When we talk about grief, we can experience memories of our own losses. I'm going to be sharing some short case scenarios just to highlight when we start talking about the different kinds of loss that come up, or different types of grief that come up with pet loss. And some of these might hit home for you. So I just wanted to invite you to practice some self-care today. If you need to step away for a minute, this is going to be recorded. So I just wanted to throw that out there as well. So when you registered for this webinar, I know you answered this question, and this is really for me, because I am interested in who's in the audience. I'm realizing as I was like posting this webinar, I didn't ask an additional question, so I might ask that even though we don't have a poll, and you can put it in the chat. You can join this poll by either scanning the QR code on the screen or going to slido.com and entering the number that's on this slide right here. I did lump a whole lot together, especially for animal care and animal welfare. So if you, oh, and I didn't give an opportunity to put other. This was put together last night, this slide, this one right here, not the presentation. So I'm realizing I kind of missed the opportunity to put other. If it doesn't fit, put it in the chat. I'm not looking at the chat right now just because I don't want to get distracted. So we have a lot of social workers. All right. Okay. Well, as you all are continuing to fill this out, it shouldn't, by me slipping over it, keep filling it out if you're continuing to fill it out. So I am a social worker, and I am also identified as a veterinary social worker. So as a veterinary social work in and of itself, we consider an interprofessional practice. It's inherent that it's an interprofessional practice because most veterinary social workers are doing work in embedded settings. Not all. I'm currently in a private practice, so I'm not in an embedded setting anymore. A lot are. So areas that are embedded settings where you might find a veterinary social worker, you might find one at an animal shelter, in a veterinary clinic, a veterinary teaching hospital. That's where I did my practice at first. The first 10 years of my professional life was embedded at the University of Tennessee College of Vet Med. You might find us in other organizations like food pantries, communities, mental health centers. We do have people who have gone through the veterinary social work certificate program and are in doing some behavioral health in other settings, but have this, we have school social workers. So you might find us in a lot of different places. So for those of you who aren't social workers, I just wanted to highlight here are some of the social work values And these are really important when we think about interprofessional practices, knowing what are, and we'll talk a little bit more about interprofessional practice towards the end of this presentation. Um, so being able to identify what are the values and ethics of the professions that you're doing some work with. And we call it veterinary social work because these values and ethics closely align with our animal care professionals, the veterinary profession in particular. Veterinary social workers focus on the human needs that arise in the relationship between humans and animals. This is the oath that veterinary social workers take at the end of their certificate program, whether they're doing it through their master's degree or whether they are doing it postmasters. And we focus on the four pillars of veterinary social work are animal-assisted interventions, the link between human and animal violence, intentional well-being, and this is one of the practices that used to be called compassion fatigue and conflict management. So this is looking at working with our animal care professionals, whether you're a shelter worker, an animal control officer, veterinary technician. So focusing on intentional well-being for those who work with animals, and then animal-related grief and bereavement. I spend most of my professional life as a veterinary social worker doing most of animal related grief and bereavement and intentional well being, although there are some things that I touch on with animal assisted interventions, and I have consulted on the link. It's important for veterinary social workers to have competency in all four pillars, even if that's not where we primarily practice. And you'll see, hopefully, through this presentation, why that might be when it comes to grief and bereavement. So again, we're not doing a deep dive. There's probably a whole lot more that could be said about the human animal bond. Not could be, there is more that could be said about the human animal bond. So just briefly, the statistics show that about 71 to 75% of US households have at least one pet. The 71% covers typically cats and dogs, but there are also those who have animals that are not cats and dogs. And so the 75% incorporates some of the other animals that people have as pets in their house, which could be reptiles or birds, fish, things like that. Again, briefly, the bond can be formed through several ways. Often it's through caregiving, the caregiving that we have with our animals, reciprocity and mutual support. We often share daily rituals and routines. There's an emotional attunement with our animals. They can provide us unconditional love and support. And then, in addition to all of these things, the role of the animal can often be important. So, animals often fill roles as best friends, family members, confidants, surrogate children, companions, protectors. And then there are other roles that animals can play. And so while we're talking about pet loss, I also want to acknowledge that the word animal and in human animal bond as a veterinary social worker is really important that not everybody who interfaces with an animal and experiences grief after their death or loss is working in the capacity or interfacing in the capacity of it being a pet. So sometimes it's tied to our professional role, the professional role that the animal has with us. So I've got some pictures up here about the working dogs in military and police settings. We have service animals. So that's a different role. They are not pets if they're a service animal. They are providing a role to help somebody who has a disability. Maybe your professional role is an animal care provider, a veterinarian, a veterinary technician, a zookeeper, a lab animal worker, or maybe even a farmer. And so these are different roles that can also where we can have relationships with animals, even if they are not identified as ours, and they're not therefore often considered our pets. So I put that out there because as a veterinary social worker, that is important, and it's a piece of the work that I do. So when the bond is broken, we experience grief. So grief is the normal and natural response or reaction to a loss. And another definition is the complicated feelings caused by the end of or change in a familiar pattern of behavior. It's an internal meaning given to an external event. It's a type of stress response. So Grief, while it's universal, loss in and of itself, a loss, the grief, the reaction to a loss is universal. 100% of us at some point, at least once in our life, excuse me, will experience grief. Grief is still subjective. It's a subjective experience because it's happening on the inside. So, some ways that the loss can occur when it comes to animals, it isn't just about death, although when we think about grief, that is kind of the mindset is that we often go to death. So, in the animal world, it could be that the loss occurs because of illness or injury, or in animals, we also have the ability to euthanize our animals to end their suffering. An animal can go missing. An animal might be relinquished due to life circumstances, whether that's the health of the human. Maybe there's a change in housing status, so someone might move, or homelessness might happen, and so the housing status could change, and we might have to relinquish our animals, or even domestic violence situations. And then there could also be forcible removal. So animal loss can occur in hoarding situations where animals have to be forcibly removed from a home. Animal care professionals on that side of things, as I said, it's about the intersection of the relationship with all humans. And so pet loss is one side of things. And I think it's also important because we're talking about grief. It's a big umbrella term. With the animal care professionals, it can also, so this is our shelter workers, veterinarians, veterinary technicians, um, euthanasia, death due to injury or illness. And then in addition, leaving the animal at the end of a shift. So it might be that you're caring for a patient at your vet hospital, you're caring for an animal at the zoo, or you're caring for an animal at a shelter, and you leave the animal. And then when you return, maybe that animal is no longer there, either because it's been transferred, the next bullet point, transferred to another department, hospital, facility, organization. So it could be transferred, it could go home to its owner, it could be adopted, or the study might end. And so a loss has still occurred. The animal's there, and then the animal is not there. So I just want to point out these other places where animal loss occurs. Again, I'm not going to go into a deep dive on the manifestations of grief. I'm hopeful that this slide shows that when that grief can produce or can manifest in all aspects of our life. So physically, emotionally, spiritually, intellectually, socially, and behaviorally. And I attended a talk one time where I heard somebody put grief in the context of a potential public health crisis, because grief is often not attended to in our society. It's sort of taboo. And so when it is not attended to, especially if we are grieving and we're having to go to work, thinking back to the COVID pandemic, that's kind of where I think I heard it, was a lot of us were grieving. We were grieving some intangible losses, as well as the loss of safety and security and health, and maybe even through deaths and things like that. And so it affects us. It makes it hard to function sometimes. I will say not everybody who experiences a grief or a loss has grief that needs professional support. So we'll talk about a few of those losses when it comes to animals that tend to indicate maybe more of a need, or other reasons why people might need more support. Um, I was going to ask, and maybe you all can put it in the chat, and I'll see if I can pull up the chat myself. The One of the questions I often ask is, what's your experience working with, or your comfort, maybe your comfort level working with people who are grieving? Because sometimes we feel significantly like we feel pretty good about it. Like I said, grief is my jam. And sometimes we're like, ooh, I'd rather not. So I'm just going to look at the chat real quick and just see, comfortable but want to learn more. Michelle, I saw your name, and I knew that I follow you. I've read your work. I hope you have a chance to give a presentation on your work. So your jam too, central to your work, comfortable but interested in learning more. Previous NICU nurse. Yeah. All right. So some of you are saying you want to learn more. I, again, am not going to go into a whole lot because I really want to. We could do a whole hour or more on grief support. The base of most everything we deal with is grief. Yeah. All right. So I love this picture. I often share it with a lot of folks. We often, as a society and as individual grievers, want grief to have a start point and an end point. It's going to end. We're going to get through it. Um, and grief is messy. It's complicated. It doesn't really have an end. And when I tell people that, some people go, "What? What do you mean?" So the way that I like to frame it is grief is something that we learn to incorporate. The work that I do, I often talk in a lot of metaphors. Grief is because it's subjective. Metaphors often are a way to talk about grief because it can land differently. So there is a grief is like butter, if anybody has heard that. Um, it's, I think, on a website called Cup of Joe. I think grief is like butter. It starts out really like a big, hard block, and then you incorporate it into a dough. And it's like at the end, it's like a croissant. So the butter is still there. It's just in a new form. Um, and so grief is something that we learn to incorporate in our loss. We don't ever like truly recover from it. It just becomes a part of us. I also like to say grief, it does not happen in a bubble. And when we experience other losses start to surface. So we might have had the loss of a human in our life and might have taken over the care of an animal. And then when that animal dies, uh, we can also re-experience the loss of the person. And there's a new term that I just kind of heard about. It's not in the literature in terms of research. I don't know. And even if you Google echo grief, they're looking at ecological grief. This echo grief, I've only seen it in social media so far. I liked the term. So it's when we experience a loss again, the old grief echoes is essentially the way that it's been talked about. And so when it comes to, like I said, when it comes to the loss of our animals, sometimes our animals are linking objects to other people or other events in our life. And when our animal dies, it can resurface some of the grief that we experienced with other losses. So, what grief reactions have you seen in yourself or others that might have surprised you? Because I think grief being subjective, it's often informed by our culture, and sometimes our culture has a prescription for how, or a subscription for how we're supposed to behave when we grieve. And so I'm just curious, when you have grieved either yourself, or seen others who are grieving, are there any grief reactions that were surprising? Hmm. Clumsy and forgetful, yeah. Delayed reactions, no reactions, intellectualizing the loss. Yeah. I often hear from people when I'm working with grievers, they'll say, I feel like I'm going crazy. And I feel like that seesaw of emotions is probably that experience. It's up and down, it's all over the place, the random explosions of emotions. Yeah. What others feel was an overreaction because she was quote unquote, just a dog. Yeah, we'll talk about that one in a little bit. Mhm. And again, our grief is often, not always, often tied to, well, I would say our relationships are unique, and therefore our grief is unique. And so our reactions, our grief reactions, are often tied to the relationship that we have with, if it's a being, human and or animal being who is um, either dead or no longer a part of our life in some way, shape, or form. Our grief is often informed by that relationship. The intensity of the relationship can often um, mimic the intensity of the grief reaction. All right, so I'm going to move on. So I've asked this question in other workshops and talks that I've given, and most of the people that I talk to are in the animal care profession, so either shelter workers or veterinary teams. Or mental health professionals, predominantly social workers. And so when I've asked, like, what's the hardest part about grief or loss? You can see some of the reactions. So some coping with the emotions of everything, dealing with how others react, uncertainty as to what to say or do, which we'll hopefully talk a little bit about moving through this presentation. Putting on a brave face. And so this was somebody who works in a vet clinic, putting on the brave face for the vet team and clients, but not giving myself space to feel it, not feeling understood or validated, caring for others who are also grieving. Many of us are in caregiving professions. Most of you had indicated that you are. Um, I was going to go back and look at, but it's stopped working on my on my other tablet. I was going to look at the who we are, but we've got animal care professionals and human care professionals, whether you're in mental health or human health care, social services, things like that. And so many of us are in caring professions. And so we can also be grieving while our clients, the people that we're serving, are simultaneously grieving. And that can be really hard. It can be challenging. So some factors that can impact grief. Again, I want to remind you, this is not a deep dive. So there are a lot of things that are probably going to be missing from the stuff that I'm presenting today. It's really intended to be a general conversation about it. The meaning of the loss or the relationship can impact the grief because maybe it's the loss of companionship or a support system, the loss of safety or security, the loss of your identity. Because if you identified as a caregiver, if you identified as a dog mom, if you identify, if you're in the animal care profession, if maybe a part of your identity is you are the one who's providing the care and your patient dies, it might challenge your identity. Loss of socialization. We know that a lot of times animals act as buffers in social situations. And so if this animal helped me to get out of the house, and I'm thinking more about dogs because I have a cat now, and if I put a leash on her, she flops. I've seen some cats that do go on walks and are social, but my cat does not, at least not yet. I've not yet had a cat who wanted to get on a harness and go for a walk. So I'm thinking more about dogs or maybe even horses. I know that a lot of my folks used to go on if I do work with, because I do work with some pet loss folks who have the death of a horse. They used to go trail riding. And so that piece is missing. They no longer have their horse. And so that trail riding, the group trail riding, is something that they are missing. And then a loss of hopes or dreams or expectations. I've worked with folks who had um, a hope that their animal was going to live long enough to meet any human children that they might decide to bring into their lives, or an expectation that you were going to go be able to take them to a place to go visit, like travel with them. And then in animal care professionals, loss of the relationship with the patient and even the client. Sometimes we forget that the animal care professionals might like to or do like to interface with the clients. And so this might be if the client's no longer coming and you enjoyed that interaction. It's the loss of that relationship, the loss of unmet goals or expectations of care. Again, if I expected that I was going to be able to save this patient, um, even if I know I'm not in control of the outcome, it's still a loss. the loss of self, the identity or confidence, and then a loss of personal beliefs and assumptions about animals. And other factors that can that can impact grief, how the loss occurred. Again, a few things that can really play into that if the loss was expected or unexpected, if the loss was traumatic. So we'll talk a little bit more about traumatic grief in just a minute. So how the loss occurred, if you were present or not present, those things might play into one's grief experience. Also, previous losses and support system. So we often think that if there is a low support system in place, that is going to make grief maybe a little bit more challenging. So there's lots of different types of grief. So we're going to briefly touch on some of these. And this is where I'm gonna have a brief case example just to get you to think, to make that connection. So disenfranchised grief is essentially about a loss that is minimized. It's not socially accepted or supported. There's not typically a recognized way of grieving. So when we think about our animals, in many societies and many cultures, when a human dies, we often have a ritual that is tied to what happens when the death specifically occurs. We have a funeral. And so there's not necessarily a recognized way, like a specific way that we do this with our animals. Disenfranchised grief can also be tied to the lack of recognition of the relationship. So again, is this important? And when I think about this for animal loss, zookeepers, animal care professionals, so shelter workers, this isn't a personal animal that you have a relationship with, and so it may not be recognized that a relationship exists. Lack of recognition of the loss and lack of recognition of the person grieving the loss. And so essentially disenfranchised grief, we call it an empathic failure. So it's the failure to acknowledge that there are feelings that are happening. And a case example is a client calls a crisis call center expressing thoughts of suicide, or they might be going into an emergency department saying that they are experiencing thoughts of suicide. They share that they recently experienced the death of their dog, and they're told they can always get another dog. Their dog wouldn't want them to feel sad or take their life, or even what somebody put in the Slido poll just a little bit ago, it was just a dog. Many of you in this may likely be like, oh my gosh, there's no way this happens. I have interfaced with clients who have experienced not feeling supported when they have called a suicide or crisis hotline number and have been told some of these things. And so this is an example of how disenfranchised grief shows up, and it can impact people. It can minimize their desire to want to continue to reach out. So we have to be careful of, even if we don't understand that relationship, trying to provide some support. And we'll talk a little bit about that in a little bit. Anticipatory grief is grief that occurs before the death or the loss. It's the loss of what was, and it can often be experienced as anxiety around the prospect of a separation, feelings of guilt, or even emotional detachment. Sometimes people think if I just detach then emotionally from this animal, then I will maybe not feel this as much. There has been some, discussion around, is this preparatory? Is anticipatory grief preparatory? If you have ever experienced anticipatory grief, feel free to put in the chat whether it was harder than or not as bad as when the loss occurred. I had an aging cat, and I had, prior to that, not really fully grasped what anticipatory grief felt like. And it was constantly like I found myself constantly on edge. Is today the day where I'm gonna come downstairs and he's gonna be dead? Um, and so lots of anxiety. I was afraid to leave the house. And so the case example, you're a mental health professional who started seeing a client who reports an increase in symptoms of anxiety. They report having trouble leaving their home. In your intake, you ask questions about animal relationships and learn that they have an 18-year-old cat who has started to show signs of decline. So it can show up and present, if you're in the mental health world, it can show up as somebody who's coming to you for anxiety, and the anxiety is around this anticipatory grief. So sometimes giving people a name for their experience can be really helpful. So knowing what it is, even if you're not a specialist in providing support for pet loss or animal loss, being able to help identify like it's common to experience that degree of anxiety. Ambiguous loss is when a loss feels uncertain, unclear, or unresolved, and it is considered one of the most stressful losses. So when I think about if you are not a mental health professional and you are working or interfacing with somebody who fits this description, you might consider referring them because this is really challenging. Human beings don't like ambiguity anyway. It contributes to lots of anxiety when there's a lot of uncertainty. And so this can take its toll. Ambiguous loss, just to kind of give you a little bit of history, was first studied around prisoners of war. Um, some examples that are tied to the animal loss world is if an animal goes missing, let's say it gets out of a backyard, or slips out of a house, or slips off the leash when you're taking it for a walk. So those are ways that the animal can go missing. Animal is rehomed or relinquished. So I think about people who have to rehome an animal because the animal no longer is either it's unsafe for the animal to continue to be in that particular home. I've worked with folks who had to rehome an animal that was having they gave birth to a child, and the dog or cat got protective of the adult and was starting to show signs of aggression towards the human child. And so the animal had to be rehomed, relinquished and rehomed as a result of the behaviors that the family was seeing and the concern for safety in the house. Other ways that this might happen for rehoming or relinquishment. I know I've worked with an animal shelter who saw they were near a military base and saw a lot of animals that were brought when folks that were part of the military were going overseas. Because there's a significant cost to having to get the animal vetted to be able to go overseas if they're allowed to have their animal on military quarters. And so that takes its toll on the family. And also, on the other humans involved in that are the animal shelter workers who are seeing a lot of animals come into their shelter, um, and they are being separated from their families. And another example of an ambiguous loss is an animal dies while a caregiver is not present. You don't have any information. How did they die? A lot of people will question, did they suffer? They want to know what happened. And so ambiguity is really challenging in these situations because we don't know and for a lot of these, even if the animal doesn't die, we don't know the outcome. If I have to rehome my animal, I don't know what's happened to them. I want to know, I might want to know, and I might not get that opportunity to know. Traumatic grief includes losses that are untimely, sudden, perceived as preventable, involve violence or threat, or involve witnessing pain or suffering. Again, this is another, if there is a loss that falls under the category of traumatic grief, this is if you are not a mental health professional, one where if you're interfacing with a client who has experienced this kind of loss, where a referral would be important because the trauma piece. So a case example, you work for a community nonprofit organization that helps families who have lost their homes due to fires. You're working with a family who shares that their dog and cat died in the house fire. If you're in a rural setting, sometimes this is farm animals, horses or donkeys, goats, who might have died in a barn fire. So being able to think about if you're in a working for a community mental health or nonprofit organization, you might be interfacing with individuals who've experienced a traumatic loss in that way. And then the overlap is cumulative grief. So people can experience an overlap of all of these. So it might be ambiguous grief, cumulative grief, and traumatic grief. Thinking about a barn fire, like, did some of my animals get out and I never see them again? traumatic because I've lost some to a fire, and then cumulative grief because it's multiple losses one after the other. I have a picture of waves because, like I said, I like thinking about it in terms of metaphors. So it's like one wave. It's like being, if you've ever been at the ocean and it's like the waves just keep rolling in, you just keep getting hit. And if you're in the water and you're getting hit, whew, can be like, let me catch my breath, and it's hard to catch your breath. So typically, the griever has not had time to process the first loss before another one occurs. So an example of this in the animal world is an employee at an animal shelter participated in several euthanasias of animals at the shelter due to a parvo outbreak. A few days later, their own pet died. So cumulative in two ways. They had multiple animals at the shelter that had to be euthanized. Um, and then, which might also have a little bit of a traumatic component to it because this might have been perceived as unpre or preventable. And then a few days later, they lost their personal pet. And then I like to just, these are not necessarily different kinds of grief. It's another aspect of things to consider. So we think about grief and we think about primary loss and secondary losses. And I've touched on this just a little bit in a few slides earlier. The primary loss might be that animal relationship through either death or rehoming or other situation, the animal goes missing. And then the secondary losses might be tied to a loss of a support system, loss of dreams for a future. If you're an animal care professional, it might be loss of confidence, loss of identity, loss of trust, loss of faith, and the loss of financial security. So sometimes I think about this when it comes to people who are farmers. Their relationships with their animals maybe has a functional role in part of their economic livelihood. And so if they have to cull an entire livestock because of disease outbreak, then that's might be a loss of financial security and another thing to be thinking of. So if you're somebody who works in a rural community and there's farmers, there's another aspect of the human animal bond and grief that's there and opportunities for providing support. So how are we doing on time? Oh, I think we're doing okay. Sometimes I go over because I have so much to share. I was really trying to stay on track, so I think we're doing okay. All right, collaboration. So, One Health is the idea that the health of people is connected to the health of animals, plants, and our shared environment. So, I just wanted to, because this is being hosted by the Center for Family and Pet Wellbeing, and we think about things from a One Health perspective. I wanted to share that definition of One Health and then interprofessional practice. And so I put up just so that we can kind of have a shared understanding of interprofessional practice. So these are considered the core competencies, and they come from the Interprofessional Education Collaborative regarding when you're working in an interprofessional setting. So there's basically four areas that we think about as far as competencies. The first is tied to mutual respect of and values, working with other professionals, maintaining mutual respect and values for each of those professions that you're working with, using your knowledge of your role and the roles of other professionals to appropriately assess and address healthcare needs of the patients. So when I think about my core values as a social worker, we have competence as one of our guiding principles, and this seems to fit. So it's roles and responsibilities and competency as it relates to the roles and responsibilities of my profession and the other professionals I might be interacting with. And then communication, very important. Communication with not only the patients that we might be working with, families, communities, and other professionals in a manner that supports a team approach to promotion and maintenance of health. So this is about team communication and collaboration. And then utilizing relationship building values and principles of team dynamics to plan, deliver, and evaluate patient population-centered care, population health programs, and policies that are safe, timely, efficient, effective, and equitable. So I'm going to invite you to just take a few moments, and if you want to put it in the chat, like thinking about who do you work with? Are you working in a setting where you're seeing older adults or children or college kids? If you're in academia, maybe you work in a college setting. I think one of the things that can sometimes be missed is um, college kids that might have grown up with animals. They leave, they go off to college, and they may experience the death of a family pet while away at college. So, on the second bullet point, how are you compassionately asking about animal relationships? And then what kinds of pet loss may they be potentially facing or have they experienced? So, like, what kind of pet loss might, or what kind of loss might that person be experiencing if you're a college kid and your animal dies while you're at home, or while you're not at home, while you're at college? Um, and what support they might need that you can either provide within, again, thinking about your role and competencies and areas of practice and expertise, and who might you need to connect them to? So the roles of some of the professionals that I think about in these situations. We've got our animal care professionals, and often they're a first line of connection or support regarding animal health. So if an animal's health is starting to decline, or an animal has already died, they are the connection with the human being, who has now experienced the fracture of that bond, that relationship. And so, or maybe you're a shelter worker and you're interfacing with the person who is relinquishing their animal because they are moving, can no longer care for that animal. Um, so, as animal care professionals, you might be the first line of connection in seeing this pet loss experience, the fracture of the bond. And so, thinking about that, and we'll talk a little bit more about what things do we want to do to potentially have either referrals and or resources available to them. If you're a medical professional, you might be seeing somebody, even though you might not be the first line of connection, you might be seeing somebody because of the impact on their health. As we talked about earlier, grief affects us in so many ways, and our physical health is impacted. People might show up with physical symptoms. I've definitely worked with people and was referred by a primary care physician because the person showed up and was having chest pain and headaches and was dehydrated and was not sleeping well, and it was impacting their physical health. And turns out that they had had a significant loss that was impacting their health. So the medical professional might be the first line of connection and the referral. Mental health professionals are in here as well. We're doing counseling, specifically thinking about trauma and grief counseling. Again, if you're a mental health professional and you don't normally focus on grief and loss, it is something because, as I said, 100% of us at some point in our life are going to be grievers. And so, how are we asking about losses that are happening in our client's world? And even specifically asking about animal relationships because animals typically last or live um, fewer years. And so for me, it is a part of my intake. I want to know. I mean, I'm a veterinary social worker, so of course it's a part of my intake. And even if it wasn't, even if I didn't operate as a veterinary social worker, I think as a social worker in general, we think about the human, the person and environment, and animals are part of our environment. And so I think thinking about like what kinds of animal relationships do they have? Because if I'm thinking about how is that animal providing support? And if something happens to that animal while I'm seeing this client, that might be something else that comes up. And I might need to refer out if it's not my area of expertise. I definitely have gotten some referrals from folks who have a primary mental health provider. I'm thinking of one in particular because she experienced the death of her service animal. And so her therapist was like, I feel like I'm at a loss. I don't know how to support her. And so she referred her to me to help work through the death of her service animal. And social service professionals, again, you might be helping or interfacing with individuals who are accessing community resources or crisis support, and you might become aware of pet loss or animal loss in these capacities, and how might you then think about who, or maybe your community resource, you work at a pet food pantry or a food pantry, and you're like, oh, they have animals. They're at risk of maybe losing their animal because they're saying they can no longer care for their animal. And so how can we get them connected to other services that provide care for animals? So there are some barriers to interprofessional practice, specifically when I think about loss, stigma. We've got that disenfranchised grief piece, and so grief in general is kind of stigmatized. And then we have the additional stigma of animal relationships. And so, how do we want to make sure that we're not continuing to stigmatize support seeking for something like the death of an animal or the loss of an animal, even if it's not through death? Time constraints can be challenging in interprofessional practice. You might perceive that you just don't have time to emotionally attend to the folks that you are, not just emotionally, but to attend to these folks and their needs. Lack of awareness of resources might be a barrier. So, I don't know what's in my community. I don't know what resources to point them to. Maybe a lack of training in grief support and or the human animal bond, although based on the chat, it looked like a lot of you do a lot of work with grief. And then the additional compassion fatigue, secondary trauma, or burnout pieces for yourself. As I said, many of us are in caregiving professions. And so hearing about another human that we're working with and a loss that they've experienced might trigger some compassion fatigue or secondary trauma or contribute to burnout. So, what additional barriers might exist for interprofessional collaboration regarding pet loss that I may not have named or just that you want to elaborate on? Training opportunities. Yeah. Hmm. Yeah. I'm assuming that PTO is the paid time off policies. And this touches on so social workers, we think about things from micro. So this is the individual interactions that we have. Meso, which is sort of the community or organizational stuff, and macro, which is typically policy level. And animals are uh, often not included in bereavement leave. So I think about that a lot. Um, and so, yeah, that the PTO policies, paid time off policies, and so um, sometimes you take PTO and it doesn't fall under bereavement leave, but you might need to. Some companies, I think there are a lot of companies, maybe not a lot, I don't have data for it. I think there are definitely companies out there who are starting to recognize the importance of animals in people's lives. I mean, again, looking at the data, the statistics of how many people have animals, and also the impact of grief on productivity and work in general. And so there are some companies who are animal friendly, if you will, and include animals as part of the bereavement leave. There's some new legislation that just got passed in Colorado. I'm on the board for an organization called Align Care Health, and our executive director was just part of um, getting a bill passed in Colorado for animals being recognized as members of the family and in terms of social determinants of health, which this is kind of the new mission of Align Care Health to help recognize the importance of animals so that we can get more resources out there for that. So siloed operations, no established pre-existing network. Yeah. So this is where sometimes we have to do the macro and meso work, again, as in social work practice, doing some work to put together those networks in our communities. It does take time, so that's a barrier. So practical strategies for interprofessional support. So grief support in a nutshell, again, I could spend a lot more time going over some of the ways that we could provide grief support because the biggest piece of, I hesitate to say biggest piece. We know that the loss of an animal, again, falls under disenfranchised grief, which is essentially, like I said, a empathic failure. I think one of the biggest things I try to invite folks to do is to start with listening without trying to fix it, acknowledging and validating the loss and the relationship, and avoid minimizing phrases. So these are like three bullet points that I would say are like grief can't be fixed or solved. It isn't a problem to be solved. It's an experience that we have in our life. And so being able to be present for somebody who is grieving can be really, really hard. And so saying things like, oh my gosh, this sounds really hard. I can only imagine how this is for you. And not saying things like, well, at least you had 18 long years with them, or everything happens for a reason. Like that only further disenfranchises and dismisses a client's experience when we don't see the importance of that. Because even if 18 years is logically a long, long time, it's not going to feel like enough. People most likely are going to say, I wish I had more time, even if they had, in a long life for an animal. So logic and the heart, that I always say there's a disconnect between the head and the heart when we're grieving. The head is going to try and logic its way out of it because that's what we're socialized to do. And it's not, grief isn't about the head. Anticipation. Yeah. All right. And then grief support isn't about having the right thing to say or do. It's about showing up and letting them know you care. And I really like this quote: when others meet us with non-judging compassion, we experience a sense of belonging that polishes the rough edges of grief. Grief is hard. And so when we feel like someone is there for us in a non-judgmental, compassionate way, oh, it can feel a little less heavy, a little less challenging. And then practical strategies for interprofessional support, referrals. When I think about referrals, warm handoffs are really important. So being able to say, hey, I'm aware of this resource. Can I help you connect with them? Or can I call and reach out to them? Or let's call together, so that you're not just, here's the support, good luck. That kind of referral might, for somebody who's grieving, might not feel super supportive or super helpful. And so warm handoff can be important when it comes to referrals. And then having resource lists for your community. And so I have created a QR code. My husband helped me do that because I am technologically okay, but not super savvy. And so I was like, I want something a little bit easy. So you can scan the QR code, or it's on my website. It's on a page that I'm still kind of developing, but I have a pet loss resource list. It is not extensive. It's not intended to be extensive. What it does have, and feel free to use this, you can print it and share it with people if you're in an animal setting, or even if you're not in an animal setting. It has a list of websites that offer pet loss support groups, or animal, like just information about ways you can memorialize your animal. It has a list of books that some people find helpful because some people like to read. So it's got a little bit of, so like I said, some websites, just general websites. It has some websites that have information about pet loss support groups. And I've tried to put some information in there about the pet loss support groups when they meet, if there's a cost associated, as well as if there are organizations that have individual counseling. Um, and then some books. And if you're in a community, start, and you're not a mental health professional, or you are a mental health professional and you're like, I want to provide support for people, start connecting with veterinary clinics and saying, I am somebody, if you're dealing with clients or working with clients who have experienced the loss of an animal and you need to make referrals, I am somebody that you can feel free to pass my name off to, because a lot of vet clinics are like, I don't know where to send them. And support groups aren't made for everybody, and not everybody wants to go to a support group. So, all right, I think I'm not going to do that one. I am just going to, what questions, what comments? We're at the end, and so like I did okay. And I want to like if there are questions that anybody has before we leave for today. All right. Well, again, thank you for inviting me to speak today. And I know it was a lot in a very little time, and there's a lot more that we didn't get to go over. Um, if you have any questions or comments, um, the link to my website was on the slide, so you can always reach out to me that way. Um, Thank you so much. I appreciate the opportunity.
Thank you so much, Sarina. Thank you all for attending. I know we're at time, but feel free to reach out. We will be posting the recording and you'll get a link in your email if you registered. So make sure to be on the lookout for that. And again, as a reminder, if you didn't put your email and name um, the webinar chat, make sure you do that for CE. You'll get a link with going through the process to get your CE if that's what you're looking for. Thank you again so much to our speaker and for all of you for joining. If you would like to see additional topics covered, whether it's going into more depth on pet grief and loss or other topics you'd like to see us cover, please reach out to cpfw@utk.edu, connect with us. If there's other ways you want to collaborate with us, we'd be open for that. And have a great rest of the week. Thank you all. Bye.
Thank you.